Thanks to Almighty God, we have given us a new day, a new hope. Today, once again, a warm welcome to our esteemed dignitaries from USAID India, Mission, State and District Senior Leadership, along with our community health officers who have gathered here for state-level celebration of Ayushman Bharat Health Wellness Centre Diwas Felicitation programme-cum-Review meeting of community health officers. As you all are aware, we have completed 4 years of implementation of the prestigious Ayushman Bharat and wellness centers. The success of this ambitious program, especially within the given timeline, will not be possible without the community health officers who lead the primary healthcare team at the health wellness center, thereby bringing the quality care closer to people's home. Community health officers are a vital cadre of a health workforce to bring quality, affordable, accessible health care right at the doorstep of our communities. It is important to strengthen the skill of these community health officers who will be at the forefront of the healthcare delivery at the health and wellness centers. The honors of building the capacity of this community health officer who are the key contact with the community lies all of us gathered here today. We have been supported by our partner Mr. Chabaiko from USAID India Mission in nurturing this gather and hand-holding of our community health officers to become a pillar to SSC, HSC, NISTA from USAID funding has been supporting us since the beginning of Ayushman Bharat Health Wellness Center initiative and has been a pivotal role in supporting state in achieving the target being given by the GOI, Government of India. NISTA has been supporting us in various digital interventions like Naga Telehealth, Teletracks, Lean, and also supported various COVID initiatives. I would like to thank our co-partner USAID NISTA Chabaiko for their support and helping us build in a strong and resilient health workforce. With this word, thank you.
Keynote address on behalf of the Government of Nagaland National Health Mission, I welcome our guests from USAID, Ms. Sangita Patel, Director, Health Office, USAID. So as a token of appreciation and as a token of love from the Government of Nagaland and NHM, we want to hand over her as a token of gift or love to her. So if it is ready, I would like to request Rosalind to please hand over. Second, Arunada Jain, who is a technical advisor, Health System Strengthening, USAID. So I'd like to request our Additional Director to please hand over the gift to Dr. Arunada Jain. Thank you, ma'am. And Mr. Vijay Paul Raj, Reproductive Health and Family Welfare Advisor, USAID. I'd like to request our Madam Marinla to please do the honor.
Warmest greeting to you, since you have come from the grassroots of our health systems. You are the frontline workers, the most important foot soldiers which determine our success. So I welcome you all the most, and this is the day for you. we are celebrating the Health and Wellness Center Day. And it is a day where, first of all, we should recognize the importance of the job, the task at hand that the Health and Wellness Center, the Ayushman Bharat, the whole scheme of thing it is trying to achieve, and your role in it. And based on this appreciation of your role and understanding, I'm sure you will have a better review meetings and improve upon the job that is being done. But I really appreciate, because we had just a few days back we had Kayakalp Awards ceremony, and the tremendous work that is being done at the Health and Wellness Center. It shows that the kind of leadership that individual CHOs display, it goes a long way in determining the success. So your role as leaders, as local leaders, is what I want to emphasize today. You see, Ayushman Bharat, the concept of HWC is basically to embed the concept of continuum of care, and this is the last mile of this continuum of care is the Health and Wellness Center. And it's a strong base if we build at HWC, and particularly in a state like Nagaland, because of its remoteness, its different topography and geography, it plays an even greater role. You see, at the field level, the role of CHO that I see is, of course, as a leader, as I said, of course, as a health service provider, but also as a community mobilizer. As a community mobilizer, you are the closest to the villages, closest to the people. You can inspire and you can deliver the services. You see, with the 15th Finance Commission particularly, and you see, we already had a Communitization Act, and these things are there. However, actual delivery has been lacking, mainly because many a times because of lack of empowerment at the local level, lack of autonomy in terms of finances at local level. And you see, with the 15th Finance Commission, which has given local body grants, since CHOs here also lead the communitization initiative at the village levels, you are going to play an important role in utilization of these grants for diagnostics, for medicines, and for other purposes. So your role is going to be very important in the coming days, and the government and the union government and the state government is in the process of strengthening your hands in delivering the services. In the state of Nagaland, and Health and Wellness Center is going to play a pivotal role, fulcrum, in providing the digital services also. Of course, the CHOs have been enabled with the tablets, and they have this NCT program for screening and other things. But this has to be connected, as the concept of continuum of care goes, to the higher level of facilities. And you see, this the digital interventions in the state of Nagaland play a very important role because of the remoteness in various districts. So if we are able to connect the diagnostic services that you provide to the higher level of services, then we can really promote e-health, telehealth, and other kind of services. I'm grateful to Nishtha to have implemented this Naga telehealth, of which the CHOs are again the fulcrum. And in the coming days, we have to ensure that this becomes a greater success than what it is displaying as of now. So I will urge you all that the care should not end at your level. It should be connected through telehealth, through e-health services, to the higher level of care. We also have, in this regard, Ayushman Bharat digital mission in place. This is going to create electronic public health, personal health record, which is going to be important because the screening that you do, the diagnostics that you do, should be stored in these platforms. In this regard, of course, you'll be trained later on as we go ahead. Of course, some training must have taken place in creation of Abha IDs. These Aadhaar IDs are going to be the personal health IDs, and these are going to connect to the different to the health records of that individual, and this is going to be the primary key for that. So you have to ensure that in the coming days, more number of people are enrolled in the system through the Aadhaar IDs. As of now, that number is very low. So I'm sure as we go ahead and as we are trained, we can improve upon this number. My gratitude to NISTHA also goes for the training of HR, the CHOs, and the strengthening of the health and wellness centers in the state. With the help of NISTHA, we have been able to get NCAS certification for Health and Wellness Center Shikazu. In fact, I would like to say that I prefer to take my child to HWC Shikazu than anywhere else. So it is such a wonderful system, a system that they have built. The quality has improved. So I think such kind of initiative we should encourage and have more and more health and wellness centers getting certified under the NCAS. NISTHA has also supported the state in the COVID pandemic through TeleTracker, Digital Runner, and other initiatives, including equipments and hardware that they have provided during the second wave. So for that, I am really thankful and grateful to the USAID. In future, we will like to, expand this collaboration with the USAID and try to have better convergence of all the digital initiatives that the state has undertaken, improve upon the diagnostics, probably through hub and spoke model, and also strengthen our HWCs in delivering these ICT-enabled services. With this, I would like to thank you all and also encourage you to participate in the review process properly, because this is important for your better performance. Of course, we are doing our best in the field, but there is always something we can do more. So thank you very much.
Number of institutional delivery, that is Ms. Tumpeni, and she is from Munyakshu Sub-Center, Mon. Please come forward and sit down. Highest FIC, that is the CHO is Visil Hunyo, and she's from Dipupar P Health and Wellness Center, Dimapur. Madam Sangita Patel, Director USAID, to give away the award. The title of the award is the highest VHND done in the year 2021 to 22, and this goes to Ms. Atrongla Mongzar from Hukai Health and Wellness Center, Dimapur. If she's not present, somebody from Dimapur, her friends can come and collect, receive the award. Family planning, the highest number of family planning done, that is, it goes to Nivitia Sono, that is from Longwa Sub-Center, Mon. This is one of the most peripheral area of remotest part of Nagaland, and it is in the Indo-Myanmar border. So please come. Our secretary. Highest wellness session health. That is, it goes out to Atahulu Tetsyo, the CHO from Naga United Health and Wellness Center, Dimapur. Simla Ke, that is Siochong Village Health and Wellness Center, Kipire. Anyone from Kipire can come and collect for her. That is also from United Naga Health and Wellness Center, Dimapur. Warning Ring Pungsong, that is from Sukuvi Health and Wellness Center, Dimapur. Goes out to Kevingunyo Letsise, and she also has another award, that is the highest COVID vaccination done, and she is from Chanmari Sub-Center Health and Wellness, Kohima. Last Saring Health and Wellness Mokchong. And Zuhu Villu Chiso from Kobe Health and Wellness Center.
In front of you today on behalf of USAID. I think that it's a pleasure for the team that's normally based in New Delhi, Anuradha and Vijay are with me, to be here and to really have gotten such a warm welcome from Dr. Torhusi as the mission director of the National Health Mission, from the Joint Secretary, Shri Ajit Ranjan, from Dr. Mary Ilema, the State Program Officer of the National Health Mission, Mr. Pearson, Jatin, our entire crew here really is humbled by your dedication. These certificates are more than just a piece of paper. They represent the hard work and culmination of dedication over the past several months and year in the middle of the COVID-19 pandemic and even beyond. I think I have to take a pause and truly appreciate that in such tremendous, difficult circumstances, in the most remotest regions, where sometimes there's not even running water or even support, that you took your training and really took the support that was provided through Japaigo Nishta, as well as in partnership with the government of Nagaland to really show that you care. I think that while Ayushman Bharat is there and we see the incredible momentum to link community and facility level care to the most remotest of areas, as we've learned already, its success or failure depends upon you. And I think that's what we all recognize in this room as partners. And I think that's why we wanted to take this space and time to not only honor you, to not only support you, but also to continue to have this space so that you can tell us as well what more you need ultimately to improve the health and well-being of the communities that you serve. None of these initiatives, whether it's Ayushman Bharat, the National Digital Health Mission, RKSK, any of these different programs that we've created ultimately to get services, comprehensive primary healthcare services out to the last mile, none of them, even COVID-19 and vaccination and care and mitigation and support, even preparedness for the health system to respond to even future challenges. None of this would be possible without you, without the motivation and dedication that you bring within communities, and without your trusted partnership with community leaders, community champions, and really other youth and adolescents who are also coming together to make a difference. So my wish is that we can continue to partner together to be able to respond to all of these challenges and future challenges, and really to have you continue to be a beacon of hope and inspiration to others. So thank you. And please do continue this incredible work and incredible support to the Ayushman Bharat program, and may we continue to see such excellence flourish. I can't help but also remark that there are a number of female community health officers here, so maybe that will be also an inspiration moving forward as we continue to support health and wellness nationwide and really inspire other countries. Thank you.
And next is Dr. Achangla, who is the Additional Director in NLTV. Dr. Ritu Thor.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 10 in Global Chapter, and for Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.